is the most common symbol that we find almost in every prescription. It looks like R, X. But in reality, this is R, that is true, but this one is not X. This is Y. So if we separate this symbol, it will be R, Y. Got it? R stands for recipe, R-E-C-I-P. So the word recipe should be very familiar with you, because when you process your food, you follow a recipe. So a recipe is basically a series of instructions on how to cook your food. That is the normal sense that you use this word in. But in the medical sense, the physician is also preparing a recipe. Recipe for what? Recipe for cure. For curing the disease of the patient. So suppose I am the physician and you have come to me as a patient, I will prepare a recipe for whom? For you. Right? You, that means Y-O-U. So that U is having the first alphabet as Y. Got it? So the symbol basically means recipe for you. Understood, everybody?
Yes, sir.
The most common thing is recipe for you. I mean, I should not say the most common thing. I should rather say the universal practice all over the world is to start writing prescription with this symbol. And the meaning of this symbol is recipe for you. I think this is clear. Right. So after we write this symbol, what do we write next? Where is the duster?
So,
What do we write? We then put a number. So after putting the number, we should now write the name of the medicine. I will come to some brief concept about the name of the medicine, which you as a student of hospital management must also know. I will come to that after completing few other findings in the common findings in the prescription. So here we are getting the name of medicine. Now comes what? So this medicine is the recipe for you. I as a physician is preparing this recipe for you. Now this medicine that I have named here should be taken in a specific dose. If I just write the name, that is not sufficient, right? Because medicines comes with side effects.
yes, sir.
So if I am not specifying any dose, that means chances are high that you will consume excess of medicine and will expose yourself to the risk of having dangerous side effects. Because side effects can sometimes be even life-taking. Right? So that is not what is desired. So I should specify the dose here. If I not specify the dose, then chances are high that there are some patients who will take the medicine in very little amounts. In that case, yeah, there are patients who avoid taking medicines. Okay. I mean, I have even seen patients, suppose I prepare a recipe for the patient goes to the local pharmacy store, and if I in the prescription write the 10 days of prescription, they go to the local store and ask for 5 days of medication. So they impose their own logic, their own judgment on what I prescribe. So there are patients who are having a tendency to take small amount of medications. It might happen that medicines be taken in such a very small amount that would be completely ineffective without any result. So if that be the case, the next day that same patient will come to me and complain, I have seen those patients. So when I inquired those patients as to how did they take the medicines, then I got the revelation that they were taking medicines not in the exact prescribed format that I have prepared the recipe for them. Understood? So I need to mention dose. That is the moral of the story. I need to mention the dose. Now, it may be, say, the medicine as it is available in the local market already has a dose mentioned in it. 250 mg, 500 mg, right? I mean, the most common medicine probably you have heard of is paracetamol, right? During the COVID times, you took your vaccines and thereafter you had a fever and you used paracetamol. And even if there will be no COVID, then also you take paracetamol very frequently. So you know that it comes with a, say, 250 mg dose, 500 mg dose, 600, 625, 650. These are all the mgs. So after the name of the medicine, I can write there as, I'm going to write it as preferably for some X mg. So X can mean 150, 250, so. Okay. Are you understanding this? After that, I need to specify that how many times this particular medicine should be taken. If I do not mention that, then what will happen?
Yes, sir.
Some patient can take, say, the medicine for as many number of times as he likes. Children are in the habit, I mean, medicines, the same medicines when prepared for children, flavors are added into it, colors are added into it, so as to make the medicine look and much more palatable, having a very attractive look, automatically draws the attention of the children. So they get into the habit of consuming excess medicines, which again is harmful. Right? So now you give them a medicine, especially it happens for the homeopathic medicines, because they actually taste very sweet. So children do frequently go and take those medicines. But this is harmful in the long run, but I'm telling you, this can be harmful. So we need to mention the number of times it should be taken. I mean, it can be, say, taken once a day, or 2 times a day, 3 times a day. Now, see, for this is one word we call it as the frequency. Frequency, I think you have already heard this term in statistics. That means the number of times data is repeated. That is the sense in statistics. But here, in the sense of prescription writing, we will define frequency as the number of times the patient should take the medicine. Right? So it can be, as I said, once a day. Now for writing once a day, we do not write that whole big word or that phrase, once a day. So that's a 3-word phrase, time consuming, which is not affordable when you have a huge chunk of patients waiting outside your OPD, right, to get the medical attention. So you need to keep things short. So how do you keep things short? You avoid writing big phrases, shorten them up. So when you are writing, say, for example, once a day, instead of writing that big full 3-word phrase, you can simply shorten it out here as OD. You might think that it is the short form of once a day. So O stands for once, D stands for day. What you have thought is correct. But basically, this abbreviation is from some Latin forms. In Latin form, this once a day is to be termed as one a die. This word die in Latin means day in English. Got it? Did you understand? Similarly, if I have to prescribe a medicine to be taken twice a day, 2 times a day or twice a day, you might think that it should be written as TD,
Twice daily.
Twice. But this is wrong. Because as I said, these abbreviations originate from the Latin. So in Latin, twice is known as bis. In English also you find a word called bilingual. Have you ever heard this? Bi and die in English refers to two.
2 and 4.
Isn't it? Bilingual, that means in Bengali means Dobhashi. Bilingual. That is just an example. Similarly, the word bi has come from this word bis. Okay? And in English we sometimes also use die.
Die.
Die is the short form of double, which
Double.
also means two. Right? So, here instead of writing PD, since these are originating from Latin, we should be writing as BD. But if we are writing PD, that should be tris a die. In Latin, which in English means thrice. Understood? So TD means thrice a day, not twice. Twice, thrice, both are having the starting alphabet as T. This can be confusing. But in a prescription, whenever you find this word written TD, take it that the physician is asking you to consume it 3 times a day. Clear? What if the physician is asking you to take 4 times a day? In that case, what is written is QD. So what does this Q means? Quarter. But in Latin we will call it as quad. Quad or die. Did you get me? What is quad or die? This one? Tris, T-R-I-S, tris or die. So tris in the Latin means 3 in English. So 3 times a day is TD. OD, BD, PD, QD. Okay? Normally you will find medicines are not given more than 4 times a day. I mean, it can in some very special situations be given for 5 times a day or 6 times a day, because understand this reason, that if the frequency be more, chances are high that the compliance would be less. What is compliance? If I have been given a prescription, I should follow it, right? But if I am not following the prescription, that means I am not complying. That means the compliance is poor. If the compliance is poor, you can result a poor outcome of that prescription. That means the prescription would not work, and the patient will again revisit the physician complaining that the prescription failed to cure. So in order to ensure better compliance, what is required is the drug frequency be lessened, be reduced. So the maximum, the common maximum is 4 times, not more than that. If you need additional medications, additional doses, it is always better to take those medications under strict medical supervision. And that strict medical supervision, obviously, is not commonly available at home. So that's why when you need to administer more frequent doses of medications, it is better to ask the patient to take an admission to the hospital, to stay in the hospital for a few days, so that medications can continue under strict medical supervision. And once that course is over, then the patient gets discharged, right? And now the compliance is 100%. Because when the patient gets admitted in the hospital, it is then the duty of the attending nurse to administer the medications time to time, right? You get the point? Okay. So the maximum common is quad a day. Now comes another issue. Doctor, already khali pete khata hoga, right? There is the next question. Whether to take the medications in the empty stomach or with some food. So if nothing is mentioned regarding food, that means you have to take it in empty stomach. But if something is mentioned in the regarding food, then it should be either said before the food or it should be after the food. Right? So for mentioning these two specifications, one is before the food, another is after the food. Now food in Latin is known as cibum. C-I-B-U-M. That is the Latin word of food. Okay? Now before means what? It can be in Latin known as ante. Ante means before. Right? After means what? Post. Post means after. Correct? So the short forms that are used here is, for this one, before the food, short form that is used here is AC. Correct? And this one should be shortened as PC. The most common thing that you will find is BDPC. I mean, if you are having prescriptions back at your home, after this class, after today's class, go back to your home and pull out those old prescriptions, find out that this should be written there. BDPC. So BD means twice a day, PC means after the food. Medications are usually consumed after the food. Why? Because if the stomach is empty, in that case, the entire walls of the stomach gets exposed to the medications. Right? So whatever the side effect of medications be, that gets enhanced. Because there is no other competitor inside the stomach. So entire stomach surface is now being exposed to the medications. So in order to avoid that kind of single exposure, it's preferably in the common cases advised to take after the food, that is post cibum. Here, some medication needs proper digestion. Some medication needs to be protected. Why? Because inside the stomach, you already know it. We are having acids. And acids are corrosive, right? Acid can cause breakdown. So if you're taking the medication even, that medication can also get exposed to the acid, and the acid can cause breakdown of the medication. So the medication is becoming useless in that case. Now if you're taking with the food, that means that acid is having other surfaces to act on. That acid will partly only act on the medications and the major part will act on the food that you are eating. Right? So the exposure of the acid to the medication is minimized if you are taking it after the food, that is PC. Got it? Some medications you require that it should be absorbed very strong from the GI tract. Correct? Now, in these cases what happens, it is usually given just before the food. Before the food, there is anti-cibum. Why? Because when you take in the food, your biological systems are such that it starts secreting the enzymes that are going to digest the food. And after that digestion, absorption will begin. In order to speed up that absorption process of the medication, medications are sometimes advised to be taken before the meals. Did you understand what I said? Are there any doubts? Okay? Now, these are the most common things that you will find in the prescriptions. But apart from that, there are situations which demand some special abbreviations. As for example, SOS or PRN. Usually this comes in the prescriptions of a hospital admitted patient. What is actually SOS? SOS refers to an emergency. So if the situation of the patient deteriorates, then only to be administered the medication. Else, not. That is the meaning of SOS. The Latin word for SOS would be C opus sit. So C opus.
Sir, I was going to read C opus.
C opus sit.
SIT.
SIT. C opus sit. SOS. That basically means that if there be an emergency, if there be an absolute requirement, only and only then the medication to be administered, but not before. Here, in contrast to that, we are having another thing called PRN. Suppose if somebody is having nowadays a fall of pressure, a sudden fall of pressure, or a fall of glucose. You know, diabetic people, they runs through the most dangerous risk of hypoglycemia. What is hypoglycemia? Sudden fall in the level of the glucose. So, if the glucose levels falls suddenly, what will happen is they will also fall onto the ground and will lose their consciousness. And if not given any kind of sweet foods very promptly, then they can even die. Right. So the advice is to give some sweetness, right? But for how long? Remember, you have to remember that the patient is a diabetic patient. So as much as is required, but not more than that. Because if you are giving more, then you are causing even greater harm to the patient. So what I said out here is, the meaning should be as much as is required. Your pressure falls down. What is the common thing? Take some salt.